one is to approve the January 2025 meeting minutes. If I don't hear any corrections or additions, they will stand approved. Anyone have any issues with the minutes? Hearing none and seeing none, the minutes are approved. We have also a reminder, our health training council meetings are recorded, and there is a change in the agenda. After the community health assessment, we will have the enough grant information. So with all those items in line, we'll proceed with community health assessment. Shelley Arkwright.
Good morning, everyone. How's everybody today?
Great.
Good. It seems like everyone's on this side of the room. I don't know. That's kind of odd, but anyway. I don't know what's wrong with Edgar and Larry. I don't know.
It's just me.
So this is our second time talking about our brand new published community health assessment. And last month we kind of worked through where to find all of the different pieces of it. And so our presentation this morning is going to be just a quick reminder about where it's located and the different pieces of it. And then we're going to get into a specific example of how we utilize the assessment. And then we'll turn it over to Lindsay. So I'm Shelley Arkwright, and the Director of Population Health, the Director of Population Health, Innovation and Informatics here at the Health Department. John Corbin, Informatics Administrator, trusted teammate, and he is our technologist this morning. So we want to thank him for getting the meeting up and running and doing all of the behind the scenes things to make this successful today. So you can advance the slide. He's driving the presentation and advance again. This is the outline. We talk a little bit about the process, the methods of our collection, our primary data prioritization survey and focus groups, the results, the secondary data, and then, as I mentioned, the example of data to action. I'm going to do that in about 20 minutes. Okay. So remember, step one is we have a partner, several partners, Mountain Laurel. We have Fred Pulse with the Behavioral Health Authority and Local Management Board, and then we have GIMC and Community Action. So our partners, we have a committee, we verify our survey instruments and the processes, and then we launch our stakeholder prioritization survey. We did that at the health fair last year, so that's where we always kick it off. We only do this every 3 years, so we don't have to do it again this year. But it works very well there. And then we have focus group, and we have our secondary data analysis. Go ahead. And as you may remember, we had a very good turnout. We had 1,513 stakeholder responses. That is regional because we work and serve in an area where we have people from Pennsylvania and West Virginia, and our partners do as well. It's important that we have a regional voice. And next we have just our Garrett County survey responses, and that's 1,430. Again, that's a very high response rate for surveys. So we always are very thankful for all of you who really are the community voices and help spread the word and get this done. All right, next. So our primary survey results, you may remember, what matters most to everyone for this iteration is access to healthcare. So 801 people checked that box as they were taking the survey. The next one is jobs, wages, and economic development at 716. Then we have affordable housing at 701, mental health 672, and health insurance 626. It doesn't mean that the other things are not important. And there's been, significant changes through different iterations. Mental health, as you remember, was first last time. So there are different ways to splice this out, but I just wanted to remind everyone this is the top 5. Again, if you go into the actual assessment online and go to the SHARP page, you can see the prioritization changes over time and the percentage of changes. So there's a lot of information to look through and analyze. I just want to remind everyone that that is there. Next slide. So go to mygarrettcounty.com, click on My Community, and then open the tab, and that is where you find all 18 sections of the assessment. Next slide. And this is where I'm going to talk about our next slide example. So this is the first time we've had a Garrett County Indicator zip code level report. All the other iterations, we had a secondary analysis that was pretty good. But this one is the first time we have zip code level data. These are all the zip codes that they report on. And it is a game changer for us because Garrett County, as you all know, it's a large geographic area and every community is unique. So we spend a lot of time in our focus groups going into each of those communities, and the priorities that they have are slightly different than the whole county. And they want to, it's important in these small communities to zero in and understand those specific needs. So this is new and it's exciting. So you find it, it's what it's called as the Garrett County Indicator Zip Code Level Report. So the way that I use that, next slide, is I went in that report, it's 900, I don't know, it's like, I think it's around 900 pages. And you download the report, you hit Control F, and you use the find feature. So I was doing some work in food insecurity. So I type food in, and then everything that pops up, just every data point that has something to do with food pops up when you do that. And that helps you sift through the data a little bit faster. So this particular screen is just it's a screenshot of one of the data points in there. So it's the indicator reports. This is the estimated percentage of the population that experienced food insecurity at some point during the reporting year. So food insecurity is the household level economic and social condition of limited or uncertain access to adequate food. So that's what this chart is measuring. It's from 2022, and it's kind of cut off at the bottom, but it's at the very bottom. And then I have a note over there. This particular thing is on page 354 of that secondary data analysis. So one of the most important things that I like is this gauge. It's really helpful. It's just a quick snapshot as you're going through, and you can see that it's most of the different reports are national, state, and then county, and then of course this one is broken down. And so we're going to skip ahead and then come back to this. So why do we use this data? A lot of grants.
Can you go to the chat room?
Okay.
Different keyboard.
This is for local. Okay, it's just AI.
Yep, it's just AI. So that's not frightening.
All right. So when you use this for any kind of reporting or any kind of grants, these are all of the different things in this data analysis, all the different data points that I was able to find. So you have free and reduced price school lunches, you have residents eligible for federal nutrition programs, you have individuals who are enrolled in both SNAP and WIC. Mind you, that's different. We have a lot of people that are eligible but aren't enrolled. The food insecure population ineligible for SNAP assistance, but that are still food insecure. We have food insecure children, people living in food deserts, food insecurity rate, and then trends over time. That's just a quick snapshot of all of the data points I was able to gather from the report and put into a grant. We have to have compelling stories. We have to have accurate, up-to-date data to be able to be competitive and get funding awards. And so this tool is designed for our entire community to be able to do that work. So next slide. So here are the results. We've been doing this for 4 years, I think, this particular portfolio of work, and it's really to improve nutrition and food security. So one of the programs you may remember is Veggies on the Move. The Health Planning Council, we did apply for a grant through our state, Maryland Department of Health, and we were able to secure funding to pay our local farmers to do this program called Veggies on the Move, where we took vegetables and produce to remote areas of the county. So that was, I think, in 21. And then we established the Garrett chapter of the Western Maryland Food Council as part of the health planning work group. So the state of Maryland wanted us to have specific infrastructure in place to make sure we were addressing food in all these different areas. The next thing we were able to do is establish the Appalachian Farm and Food Alliance. That's a nonprofit. So we used state dollars to create a nonprofit so that people could be more competitive, more nimble, because up to this point, we weren't able to purchase any food to address food security. I know. So this nonprofit was created so that we were able to do that as a community. The next thing that we were able to do is have a pilot called the Harvest Hub Meal Box Pilot. Last summer, some of you may remember, we worked with several farms. Actually, Commissioner Kitchen was one of those farms. And we were able to create meal boxes that had a nutritious, healthy meal that served 4 people, had a recipe card and a video tutorial on how to prepare that food. We worked with the school system. Community members were able to buy that. The community members were able to donate a box, and then people that had SNAP cards were able to purchase it for $5. And what that pilot program did was really bolster our farmers. We did a lot of support, a lot of marketing for them, developed branding, helped them kind of have a presence. And then we also were able to reduce some stigma with that, because everyone was getting the same food. Everyone was excited and centered around this healthy, nutritious, locally sourced product. Then we were able to use all of this, so it all builds on top of one another. And we're a partner of the HERC Award. And that is the Healthy Together program that AHEC West is spearheading. We talked to the Health Planning Council about that a couple of months ago. Our partners are in the back, David Stewart. And basically we're doing the Harvest Hub again, continuing it through that award to help improve nutrition security and reduce food insecurity. We're also doing food voucher distributions. And then that leads us to the most recent, which is a creation of a food bank and a resource hub. And that's going to be at 360 West Liberty. That's a partnership with Community Action and Lorena at Maryland Physicians. So this is just one example of one body of work that utilizes the data from the assessment to continue building on and getting grants to address something that our community has said is a pretty big issue. So last iteration, nutrition, if you remember, was the second priority area. That's a broad priority area. Does that mean people want improved nutrition? Does that mean people don't have enough to eat? Probably all of the above, right? And so we're doing that in this body of work. So let's go back to the ranking slide. So we had a question about how you prioritize where to go with the food distribution. What do you do? So through the grant, there's always things you have to follow. There's prescription, there's, different deliverables. And AHEC West is spearheading the HERC grant. And so they started in Friendsville. It's one of the communities of need. And so they said, we're starting in Friendsville. So we start in Friendsville. You can see, I don't have my zip codes written down. Does anyone know the Friendsville? Thank you. So it is 15.5%. So that's really the rate for all of Garrett County.
Now this is like that's
2022.
Yeah.
Mm-hmm. Always good to remember. We don't have any other data that's newer. That's always what we have to work. This is actually pretty new comparatively. So that's always a good reminder, Thomas. Thank you for that. So next we went to Grantsville. And Grantsville's, anyone throw it out for me?
21536.
21536. Where are we at? Down at the bottom.
Yeah.
15.5%. The next one we're going to is Kitzmiller, which is I think 21532, and that's 38 down here. That's 17.28%. So we have to hit all of our remote communities, but this is an example of you can use data and try to figure out based on that data as one element of your decision making where to go. So it not only helps you get funding, but it also helps you be data driven in the decisions that you make on how you do programming. Okay, next slide.
And one of the other important things to point out here that we were talking about yesterday in our meeting to kind of prepare for this is that not only are we looking at the percentages, but also the concentration of people. And I think that that's where a lot of this is really, really valuable because some of the zip codes, because of the way Garrett County is chopped up, have very small populations. But like, for example, when we started off with the HERT grant in partnership with Lydia and David at AHEC West and Missy and several other folks, you know, Oakland wasn't one of the included zip codes, but when we actually look at the food insecurity need, there's about 2,099 people that had identified that. So we're trying to figure out how we can serve them and really, you know, how we can make sure that our zip code coordination system doesn't divert need from certain areas. So this is really important when we're looking at concentration of poverty grants and all of the different things that are zip code reliant, because 21550 is such a giant block of all of these different communities.
Also, just looking at the top, the 17s and 16.92s, those all seem to be in Allegheny County.
Yes, so this is one thing that we also expanded. So there's more to come. There's a couple new updates. So not only are we doing the zip code data, thankfully we were able to find the funds. Jennifer found us some magic money to be able to drill down a little bit deeper. This may not happen in the future, so utilize this for the next 3 years as much as you possibly can. But one of the reasons why we selected those other zip codes, and something that we've also learned, particularly from the event we just had in Grantsville in partnership with the library, is that we have folks that come from parts of Garrett County that are assigned to zip codes that we traditionally associate with Allegheny County. So we actually got with the planning office this year when we started this process and really looked at where people were living, what zip codes they were assigned to. Because in the past cycles, you know, if somebody had a Lonaconing zip code, we threw them over to Allegheny County and we're like, they're not in Garrett County, but there are people with a Lonaconing zip code in Garrett County, inside of that border. So one of the things that we just didn't have a lot of experience in, because I don't go out and do a lot of outreach on that side of the county. That's just not something that I've done in the last decade or so. You kind of learn that through that process. So I think that we need a little bit of a better feedback loop to make sure that we're getting all of the right people.
And not to beat it to death, but do you happen to know, if you don't, that's fine. Do you happen to know what Allegheny County's food insecurity rate is if their zips are all trending higher than ours?
I'm glad you asked that as well. So we are partnering. I don't know if our Allegheny County partners are on the call or not, but we are actually merging our process with Allegheny County's process. So for the first time, we will have pretty much identical health assessments. So they will both have the same data. They will both have the same relatively the same survey instrument. They're going to collect prioritization the same way. And we're working with them because we really need to figure out how we can best serve both populations. Cancer care, which we're going to talk about a little bit later, is a really important area where that came up. So we had some conversations with the Allegheny County Health Department, and we realized that we had to figure out, because they were traveling here for some cancer care, and our patients are traveling to Allegheny County for different cancer care. So we basically have not enough and too much, and then not enough and too much. So people were kind of crossing back and forth across counties depending on what type of care they needed. So that's just one example, but this will be coming out for Allegheny County too. So their assessment, their prioritization survey is currently open right now. The library system in Allegheny County is actually one of the partners. So they're collecting all of that information, and then we have already worked with them to do all the secondary data reports. So they will actually be identical to what you see for Garrett County.
And then the HERC funding, Lydia and David, I keep referencing them. You guys should just come on up. That funding does cross both counties. So it's partnerships in both Allegheny and Garrett. And it's one of the most exciting opportunities we've had to be able to close the loop on referrals and actually do really in-depth work with the people that we're trying to serve. So that's the main point of that grant. And so more to come on that for sure. Okay, next, I don't know where we're at. Okay, right. So now, this leads us to the community health improvement plan. So this has expired 21 through 2024. You may remember that this is a working document. So the assessment is this data collection, and it's a very specific point in time, but we kind of use that as a baseline, and then we move into the community health improvement plan. And it's really an opportunity to amplify our mission, to amplify our voice. This is based on the action groups and mygarrettcounty.com. And we have very specific programs and hyperlocal data that we track over time to see how we're doing with our priorities. This is community-wide. This is not only the health department. And what's really exciting about this work is that as we use our new health assessment and the data points there, we are going to be going into these remote communities to do the community health improvement plan, and we haven't had the opportunity to do that before. So that's my kickoff point really to Lindsay, who's next on our agenda, because she's going to talk a little bit about the Enough grant and the focus of that. And this particular community health assessment and the data that we have is wrapped into that work. So that's what's next, and that's the next way we will continue to use the assessment. So.
Hi, so my name is Lindsay Broadwater. I'm with the Garrett County Local Management Board and Local Behavioral Health Authority. And like Shelley said, we're going to talk a little bit about the Enough initiative and the grant that came from the Governor's Office for Children. Thanks, Sean. So Enough is an acronym engaging neighborhoods, organizations, unions, governments, and households. It's first of its kind, as Governor Westmore likes to say. It's a first of its kind state-led place-based investment strategy designed to create poverty-fighting opportunities driven by communities, data, and cross-sector partnerships. So this data that Shelley's presenting is really wonderful for us to be able to tie into the data that the Governor's Office for Children also recommends that we use. It was signed into law by Governor Westmore on May 9th, 2024, and is administered by the Governor's Office for Children. So there were 2 grants that came along with the Enough initiative. The first one was a competitive grant that Garrett County was not eligible for this round. It was based on poverty concentration, children poverty 30%, thank you, Fred, per zip code, and then also tied in some community school data as well. So there weren't any communities in Garrett County that quite met that. But we did get the Enough Local Management Board capacity building grant that went to all local management boards in Maryland. So the point of that grant was to leverage the local infrastructure that LMBs provide to support local communities and achieve the goals. So in Garrett County, this grant supports 4 communities that were most impacted by child poverty as shown by the Governor's Office for Children. They had a eligibility map that had the poverty breakdown. So Accident, Grantsville, Pittsmiller, and Bloomington, according to that map, were the most affected by childhood poverty in Garrett County. And so these are the activities that we are planning to do with our partners for the LB capacity building grant. So the first step is to hire a program coordinator for the Population Health Innovation Informatics unit to hopefully kind of be more of a boots on the ground type of person, collect some data and help these communities with some technical assistance type things, achieve RBA certification. John Shelley, myself, and Katie Shadle in our office are working on that. So it won't be just Fred RBA certified anymore. We're going to plan and hold some RBA community workshop sessions within each of those 4 communities.
What's an RBA?
Thank you. I'm talking too fast, getting at myself. So it's results-based accountability. It's a framework that all the local management boards use. They work from ends to means Fred, please jump in if I'm missing anything. So we look at the results that we want and kind of work backwards. How do we get there? In a very brief nutshell, if that makes sense.
Could you say RBA again, please? What does it
RBA
stand for?
Results-based accountability.
Results of,
Whatever so for example, one of the results is healthy families. Okay. They want all families in Maryland to be healthy. So then they have indicators. So how do we measure that families are healthy? Maybe it's access to healthcare. So then we work backwards. How do we get people to have access to healthcare? Does that make sense? If he
I'll ask Elon about it.
Okay.
So if you
He's our
go back to the goal,
statistical genius.
John, go back to the goal. Yeah. So here's the goal. It's end child poverty to increase economic mobility in Maryland. So from a results-based accountability approach, this is the population outcome for everybody in Maryland. So then what for Garrett County, what's the same goal? Most people would say, well, of course we do. We want to end child poverty and increase economic mobility in Garrett County communities. So that becomes still the population accountability goal and the outcome. Then you go down below and then you have the indicators, which is what Lindsay referenced. Those could be things like, what's the unemployment rate for different age groups? What's the employment rate? What's the education background for people? What are the degrees people are getting? What are the trade services involved in Garrett County as opposed to multi-million-dollar career opportunities on Wall Street? So what are Garrett County people offered? What are they provided? And what's the income that people can earn in Garrett County? And then you compare that with the data that we're obtaining and collecting from employers, from the community, from social services. You look at the SNAP and the WIC, who's eligible, but who's applying. And we talk about all this all the time. And we know that there's this, I don't always like to use the word stigma, but I will because it's already been used today. But there's a barrier that people experience when they know they're eligible for something, but they don't necessarily want to apply for something because they might think people are going to judge them. And so they just don't do anything. And so the objective is, and that's where we're trying to pull everything together with the HERT grant as well, is to do outreach opportunities for people. So we meet people somewhere like at a food distribution location. And we say, hey, this is so-and-so, are you experiencing any of these areas in your life? It could be anything. Health could even be healthcare because number one priority is access to healthcare. But that also includes mental health and substance abuse care because that's considered healthcare. Brian talked about that with the Coordinated Community Health Center last month. And the state of Maryland is having some trouble with that right now in the legislative session, just to let people know. You want to listen to the hearings. So that's some interesting conversation. But I just wanted to make sure that everyone understands that the population goal is to end child poverty and increase economic mobility in Maryland. The performance accountability will focus on the programs or the service strategies that are going to be implemented. And then that will relate to other initiatives in the county. It could include the food bank and resource hub, for example. And what role does that play? It could include expanding applications to or enrollment in WIC and healthy family, or not healthy families, but SNAP benefits or health insurance as well, because I just heard in a sidebar conversation that Garrett County is the lowest.
No, Garrett County has the highest uninsured
Yeah.
rate in the state of Maryland. Maryland Health Benefit Exchange puts that at 9%, which is around 2,600 people.
Yeah.
And the stigma point you just made, there's a lot of stigma about applying for Medicaid.
Right. Yeah. So, and then we have these system barriers that we haven't taken account yet that are coming in from the federal government down to the state government. It's a pass-through issue. And so there could be some eligibility issues with how much is Medicaid going to get cut, for example. And the cut at the federal level will lead to cuts at the state level. But then depending on the population base, it could change eligibility criteria. And then do we have a navigator that we can hire through the LMD, for example, to then do some outreach and help people enroll in Medicaid, non-threatening. We don't want to have people go to DSS, and we don't want to have people come to the health department. So what about at a food distribution location? Why not do that and partner with Mount Laurel, Community Action, or other entities in the county to have these individuals that can say, hey, hello there, Fred. It's great that you're here. Is there anything else we can help you with? Let me talk to you about some things available in the county. And we
So-
can do some stuff.
We're gonna do it next slide, John. An accident, so the communities that this grant is focused on is Accident, Grantsville, Kitzmiller, and Bloomington. And so we're not going to tell people in accident what they need. They're going to tell us. So that's sort of the caveat behind going into the community, making sure we have ample opportunity for people to have the training, to sit down with us and develop these action plans that will hopefully be able to be measured so that then we can see how we're collectively adding to this ultimate population health goal. That's what we've been doing for a decade through this work, but this is just specific funding for these specific communities to really do it a little bit more in depth and get a planning group together in these different areas. And all of this work, like Fred mentioned about the food distribution, that's just one program that we can use when we are reaching out and screening folks. And so we're talking about a couple of different things at the same time, but it does all fit together. And we are hoping that in these enough planning groups that it'll be people with lived experience. It'll be people that have, from all different walks of life, all different socioeconomic classes that can work together. So it does take a little bit more time, and it does take evening hours, and it takes weekends, and it takes things that, traditional bureaucratic government doesn't, we don't like to work on Saturday. And so that's why we have some additional funding to be able to spend some time and help people understand what it is that they can even do in their community. And results-based accountability is the framework that Lindsay mentioned. It's just one way of thinking about how to help people get there. A good Google search for later. It's actually really good information.
Yeah, thank you, Shelley. And also should point out that the community members that are attending the results-based accountability workshop sessions, they don't need to know how RBA works. It's for the person facilitating. That's how they steer the conversation. So if you're contributing to results-based accountability conversation, you don't need to know results-based accountability. So it's really a wonderful framework. So if we don't have any follow-up questions on that, thank you, Shelley and Fred. So the next step would be to coordinate any follow-up community activities. That will be Shelley and John's heavy lift there, and hopefully the new staff member in their department can help a little bit with that. So like Shelley said, the community members are really going to steer what those activities are. So we don't know yet until we have these sessions. And then also provide a little bit of technical assistance to those communities for the development of a governance structure so they can kind of hopefully keep that ship going beyond this grant period. And then assist in the implementation of the identified strategies that will come out of the workshops.
And we'll be doing this in partnership with many of you. So the libraries are a key partner. People gather there anyway, and they have a lot of the same mission that we do, and wanting to serve the community and serving the same population. And they're in all of these different communities. So, and many others. So be watching for more information on how to get involved in those groups.
Thank you, guys. I think that's all I have. Whether you have any questions specifically for me?
Where does the money for all these grants come from?
Well, this one's coming from the governor.
State or state tax?
Governor's Office for Children.
There's several grants in this. Are there a bunch of federal grants in there
So
that come to the state and they come to us? And so if you cut them off at the top, the money's going to stop flowing to the grants all the way down.
Yeah, it's a tumultuous time. Isn't it?
What was
It's a
that?
tumultuous time. For sure.
So these come from state general funds.
Tumultuous.
Dr. Pope.
That's a big word.
See, I get what, these come from state dollars. It's state general funds, so there's no pass-through money from the federal government. So this is voted on through the Children's Cabinet for this legislature in the state of Maryland. And then Governor Moore will say, here's my initiative. This is what I want to see happen for kids and families. The Children's Cabinet will be assigned this task to put the budget in, and it'll either get approved, not approved, reduced, but it will not be fully eliminated.
And it also depends on the federal Medicaid dollars not being severely reduced, because if those are taken away, then state dollars are much less. And then nothing gets passed, even though the governor wants to, he's only got so much money himself.
But he doesn't have any. You'll get
Sounds like he does.
There's an important caveat with this though, is this ends at the end of this fiscal year. So this is through June 30th. So this is going to be a pretty quick succession. So this is basically going to launch here fairly soon. I need to complete my RPA training, but this is going to get off the ground pretty quickly. And we want to kind of coincide it with the things we're doing in the communities. Like the food distribution we had in Grantsville with the library was absolutely phenomenal from what we consider like a standard event. Like, I mean, there were people out the door, the library staff were pitching in to help us coordinate everyone. We could not have asked for a better outshowing of support. We couldn't have asked for better infrastructure support from the library. So while we were doing some of these HERC activities, like the first like half hour to an hour, I don't think Shelly even looked up. Like she was just like flinging paperwork out as quickly as possible because of our documentation requirements there. But I mean, I think that there's a lot of opportunities to kind of capitalize on the systems we have. We don't know what the future is. I think that that's a fairly fair assumption at the moment. But this will be a very quick turnaround to figure out what that baseline is. And then hopefully there will be funds to support it. But it's too soon to know exactly what the support system is going to be, I think, in my opinion, for this.
So can I just add something? I think it's a good point about the funding question, but there are different streams of money. And for example, Healthy Together HERC, it's wholly funded by the state of Maryland. It will be less affected by any Medicaid cuts. It won't be affected by Medicaid cuts. Now, it would be affected by state budget cuts, but not the Medicaid. The program that's going to be affected by Medicaid cuts is my program, the health insurance program. So I'm sure we'll all be talking about all this as things, I mean, right now, all the shoes are up in the air and they're not dropping on the ground yet. We'll be talking about those cuts. So I think people here will get a clearer picture, but right now, nobody knows. Everything's up in the air.
And they may not be things that cost a significant amount of money either. Like looking at some of the specific indicators that Fed's office has access to, that might be something that we can figure out down the road how to share a little bit better. But I think that in looking at some of the particular areas, they may not necessarily be cost prohibitive to implement. Some of the areas around workforce and other areas are not things that require like 4 staff members to contribute to. Sometimes it's just a bit more of a coordination piece or something that may not have a huge price tag attached to it. So I think that we will find some strategies are very expensive. Like when you're paying for food out of pocket, like that's just, you know, a spent expense. Like you don't recuperate anything from that. So that's why it's a really challenging thing to do to address food insecurity. And it's why we're really thankful for this partnership that we have. But I do think that there will be some strategies because we've seen them, like there's a whole evidence base that goes along with this. I know the local management board gave several presentations that they have shared, and all of the minutes have been sent out with presentations. So all of that body of knowledge is available. And the other thing I will say is that years ago, we participated in a project with Loch Lynn when they had a grant from the Maryland Department of Planning. And they had really, really great strategies. They weren't super cost prohibitive, but unfortunately, there was just no money attached to any of it. So we had all these great ideas with health initiatives and things that we wanted to do, but a lot of those were really cost prohibitive. But I think that what's really unique about this is there's a whole spectrum of things that are available. And we might find out completely different things by asking the communities what they actually need. You know, when Shelley and I were in Grantsville this week, I don't spend a lot of time in Grantsville. I'm a far southern person. Like that's a long haul for me. And I am just not, I wasn't prepared for the kinds of issues that they had compared to the issues that I am familiar with on the southern end of the county. And I think that there is a difference. And I think that we need to figure out what specifically each of these communities really needs.
Thank you.
Thanks, Shelley. Well, thank you, Lindsay and Shelley and Paul. Our next speaker is Autumn Friends with the Cancer Coalition.
You see me if I stay here? Okay. Hi, everyone. My name is Autumn Friend. I am a registered nurse here, and I am the coordinator of our CPEST program. I'm going to read some of my notes because if I don't, I will be up here for an hour. I will blab the whole time. So our CPEST program is our cancer prevention, education, screening, and treatment program. Some of you may have heard Judy Sines' name previously. She was the previous coordinator for I think 15 to 20 years. I took over that role when she left. So this program intends to offer cancer screenings for currently skin and colorectal cancer screenings to qualifying Garrett County residents at no cost. I've had a lot of people ask about the BCCP program in relation to CPEST. That is the breast and cervical cancer screening program. It used to be here at the health department through Garrett County. It is technically no longer through Garrett County. It is a regionalized program through Allegheny County. And actually, John, you may be able to chime in if I say anything incorrectly about this. BCCP, the regional hub is through Allegheny County, meaning the funding is there now. Patients or clients, I should say, in Garrett County can still receive breast and cervical cancer screening up here through Oakland MRI or any providers here. It's just not paid for through my grant. It's paid for through Allegheny's grant, if that makes any sense. So, with this, I'm here as part of the CPEST program and also as a member of the Cancer Coalition. According to the legislation, the purpose of organizing, managing, supporting, and sustaining a coalition with each jurisdiction is to assist the local health program, so to assist the CPEST program. During COVID, the Cancer Coalition took a huge hit from what I've heard from previous coordinators. People weren't coming in person anymore just because of social distancing and things had to be cut back, newsletters were sent. But I'm trying to kind of revamp this coalition. I really want to get more community members involved, people from different physicians' offices, our hospital coordinators, things like that. I feel that with strong collaborative ties between local health programs and all these representatives, I can significantly, I should say we, I don't do it all myself. We can significantly enhance public health initiatives designed to reduce tobacco use and health disparities related to tobacco use. So during meetings, I don't have any slides for you today. I just wanted to hit the tip of the iceberg. I didn't want to be up here forever. But during meetings, I'll discuss data related to like who is being screened through my program, what barriers to screening that we're seeing, how many people that we're seeing in the community, who is not qualifying for this program, and I'll go over the qualifications with you as well. So before I move into a little bit more details about the coalition, does anybody have any immediate questions about the cancer screening program? Anybody in the chat? Okay, so like I said, right now we're just doing skin and colorectal cancer. I am currently trying to expand this program to include a lung cancer screening module. We have a very high prevalence of smoking in our area. So I'm trying to coordinate with WVU medicine pulmonologists at Ruby, some physicians here at the hospital who can do CT scans for lung cancer screening. So that is the infancy stages of me trying to expand that, but I'd really like to get it. I'd like to have it happen because we have a lot of people smoking in our area. So with the part of the Cancer Coalition, it's kind of hard to explain. It is a requirement of legislation that participating individuals complete an appointee exemption disclosure form, meaning anybody in this meeting would have to complete an appointee exemption disclosure form. Ethics law prohibits a state official or employee from having a financial interest in or employment with an entity that contracts or receives funds from the state. So basically, anybody who is a participant or a member of the Cancer Coalition has to sign this form to basically prove there is no double dipping for payment, if that makes any sense. I've never had anybody on the coalition have to be exempt in a certain amount. They usually just say non-exempt, but it is a requirement of MDH to have it signed. I have hard copies for everybody here today if you want to sign them. For those of you who are online, I'm happy to email them out. You can just sign them, give them back to me. I do have to send them to the State Ethics Commission. Questions about that? I know that's kind of fancy. Questions about anything? Okay, next time I come,
Are the screenings free?
they are considered to be received at no cost. It depends on the insurance status of a patient. If, for example, a patient has Maryland Medicaid, that will cover the screening completely. So I would enroll them in the program as what is called patient navigation. So I will help them, connect with their provider, help them understand the results of their screening, because sometimes, especially if you have a colonoscopy, they come and talk to you when you're still a little loopy afterwards. So you're not sure what they told you. So I'll call them and follow up, let them know what they found, things like that. If somebody has, say, private insurance or commercial insurance, and they have a really high deductible, I can help pay for the co-insurance and co-pays related to that screening.
So there's no actual out-of-pocket.
There's no actual out-of-pocket cost for the client. Good question.
When you encounter people who don't have insurance, what do you do?
I will typically refer them to MSHIP to see if they qualify for it. If they do and they sign up for it, great. They just stay with me as patient navigation. I just don't actually pay for any of the screening portions of it. If they, for some reason, do not qualify, they'll stay with me and I'll pay for the screening in full. I will also sometimes refer them to Mountain Laurel. I don't really know all of the details about how that
That's
works.
what I
but
was
do
wanting you to
know.
say, that you send them on to Mountain Laurel.
Yes, okay, I do know that there is a representative up there, Lisa Skipper, who can help them with that. So that's usually what I do.
Somebody must report us.
Okay, good. Awesome, thank you. Good question. Well done.
I have a compliment and a question.
Oh.
I think you've done a really phenomenal job revitalizing the Cancer Coalition. I think it's a really important piece of infrastructure. Years ago, tying this back into the community health assessment, Garrett County was a complete outlier in terms of cancer care, coordination, screening services. So when you look at all of the Appalachian communities surrounding us, it's the 5 counties in West Virginia, the 4 in Pennsylvania, and the 3 in Western Maryland. Garrett County was really a standout. So it'd be interesting when we kind of dive into that data to see a little bit more there. But I think that what you're doing with the Cancer Coalition and trying to expand the services is really important. And I think that that's something that we really have needed in Garrett County since the loss of BCCP, because it really did affect our access to screening. It's a longer process. It just takes more paperwork. It takes more people. It is a little bit more difficult. But the other thing is, in addition to lung cancer screening, could you also maybe talk about Cologuard?
Oh,
The
Cologuard.
wildly popular Cologuard.
Yes, okay.
I get a lot of colorful explanations.
I'm glad
for
you
people wanting
mentioned that,
Cologuard.
because it just happened, so it's still not, should have been fresh in my mind, but it wasn't. So currently right now for colorectal cancer screening, our program offers FIT testing, which is the at-home fecal immunochemical test. Basically that test detects the cold blood in the stool. It is better than no screening at all, but it is also not the most reliable. The colonoscopy is the gold standard. But we have had a lot of physicians and especially community members asking about the Cologuard test. The way that that test works is that it actually detects cancer markers in the colon. So it's a little bit more sensitive than the FIT test. So if you have an average risk client who really does not want a colonoscopy, some people really don't want to be under anesthesia, they have contraindications to going under anesthesia, the Cologuard is a really good option. So we have been fighting, meaning a lot of the counties in Maryland have been fighting to get contracts with Exact Sciences to offer Cologuard to patients who are average risk. And we did it. We have that contract now. Cologuard is an option. It is an at-home test. So I think that's going to be a really good option for a lot of patients who have barriers to care, such as transportation, or just simply don't want to have the colonoscopy procedure, don't want to do the prep. So we did get that secured. I'm excited about that. Anything else? Good. Okay, guys. Well, thank you. I will be at most meetings giving you guys updates, more things. I'll have some slides for you next time. Just wanted to give you guys a little bit of a tip of the iceberg. So thank you.
Thank you, Autumn. Great information this morning. We're at agency updates. I'm going to start from the room here on this side. Here, anything from the library? John?
I got a couple things. So, the health department, we have a ton of events happening. So please check out our calendar as the weather gets nicer. We have a lot of outreach events happening. We have a lot of new classes, back to cessation, getting back to that lung cancer issue that we have in Garrett County. So there's a lot of things that are posted on there. Please check that, because we're getting to the point where there's so much going out that you might miss something. So that there's a lot of those available. The health fair, I want to give a quick update on the health fair status. So we are quickly putting together all of the health fair information. We are really trying to expand a lot of the marketing this year, trying to really draw in a lot more of the families and continue to increase our population back to kind of the pre-pandemic levels. So we are trying to kind of spice things up a little bit with the health fair. There is a new website that launched within the last week. It's garrettcountyhealthfair.com. It has all of the information available so far for the health fair. It has information for vendors and sponsorships. Best consideration for sponsorships was yesterday, but we can still accept you for advertisements through the end of tomorrow, before we place any of the theater advertisements and some of the other pieces that go out for the health fair. Vending applications are also available on there. And I think that we're going to continue to post a lot more. So I have a lot of media from past health fairs. We really needed a place for all of this to live. So it's now going to live on garrettcountyhealthfair.com. The .org will also take you there, because I have learned my lesson that people like to type things in. So those are now available, and we're going to start sending out some emails on Friday with some of the information, screenings, different services that will be available. That's going to be a key piece as well, is trying to get back to doing more screenings, demonstrations, and really just try to make it a little bit more valuable. And then the long-term goal with building out the website and some of those other pieces is to have more opportunities to share things throughout the year. So sort of a different vehicle for folks who come out to that, but may not necessarily come in for other services. So more to come, garrettcountyhealthfair.com.
Yeah, I just want to talk a little bit about the health insurance world and AHEC a little bit. Lydia here is the program coordinator for Healthy Together, which is funded by the HERC program. So AHEC will be in the same building as the food hub and the food pantry. So we're going to be rotating our services in and out of that space. It's the place that has the Shentel sign. It's a little tiny room, but we'll be there. And so in the health insurance world, with finally getting good data about Garrett County after years of not, 9% uninsured is roughly 2,600 people who, and most of those people we think probably Medicaid. They're probably low-hanging fruit to get enrolled if we can get over that stigma that we mentioned earlier. But I just want to highlight Mountain Laurel. Always send people, if they don't qualify at the health department, send them on to Mountain Laurel. They do in excess of 500 appointments a year for health insurance. Skipper's been doing this for a long time. AHEC will have a presence in Oakland, and we are finalizing, and that's thanks to Community Action. And we're finalizing arrangements with the city of Westernport, and we will have a location in Westernport. And the way we work is we try to get families with children or complicated family structures that could be Medicaid eligible to the health departments. Not always possible, right? But children, first option is to go to the health department. Low-income adults will sign up for Medicaid all day long, right? It's a much simpler process. It's very clear what the eligibility requirements are. But because there are just so many things to benefit families, we always push them to the health departments unless they just, for whatever reason, won't go. So we're going to be more visible in Garrett County and in Westernport. We will have, all our programs are going to rotate in and out of these spaces. So I just want to put that on the radar there for everybody, and I think I'll hand it off to Lydia.
Hello, everyone. So with Healthy Together, a lot of what we're doing for community outreach is we're following the food, because when people need food, they often need other resources as well. So that's where we're finding people that may still need health insurance. We're referring them on to our navigators at AHEC West or also Mount Laurel. And then in addition to that, we're also working with the senior centers We're going there over lunch. We're talking about what we have to offer there as well. So those are the two main areas. And of course, regular community outreach events that are happening. We're going wherever we can in the community to let them know what we have to offer.
Hi, Caroline Evans with the WIC program, so the Women Infant Children's Program. I just want to put out with our budgets, you know, of course, we're still under what's called a continuing resolution. So at this point, we are still running as normal, and I think there's been a lot of questions about, you know, well, okay, so if I've got WIC and I go to the grocery store to use my card for my foods, you know, is it going to be available? Yes, we are still up and running, and even if we have slight cuts, I know that we are good budget-wise. So continuing resolution, they're going to vote again in March. You know, we would have funding for our it's at least a month or two afterwards if we were to have cuts.
And if not,
And if not, we are still running status quo. Well, we're running status quo.
how quickly could the government cut off the access of our WIC clients to food?
That's a good question. So it would definitely take some time. Maryland WIC has enough funding on the back end to cover, like I said, our participants for at least another month or two if we were to be cut.
Any other questions? Any other reports? How
I
about
have one real quick,
Oh,
sorry.
go ahead, Shelley.
So on March 28th, guests who will be utilizing the Food Bank Resource Center are invited to an open house from 4 to 6. It's an opportunity for those community voices with lived experiences to come and share how they want the food bank and the resource center to operate. Again, this is really for people with lived experience who will be utilizing the site. We already had a visioning session for our community partners and agencies, but this is a little bit different. Light refreshments will be served. If you are a community agency or you're just a community champion and you have people that you know would utilize our food bank and resource center and want to coordinate helping get those people there, please reach out to me. We do have a couple agencies working with us to do that. And GTS is also going to stay open and help transport people for that event. So, and the food bank and resource center is nowhere near open, just to be clear. The open house is just to the space. There's some infrastructure that needs to happen, some construction going on. So we still don't have any refrigeration and things like that. So this is more opportunity for feedback and for us to try to understand and coordinate what we actually need based on what people tell us who will be utilizing it.
Anyone online have anything to share this morning?
Hi, good morning, and thanks for all the good presentations. I'm going to be on site next week in Garrett. I'll be there Tuesday and Wednesday next week. So I'd like to run into some of you face to face, and I'll be probably stationing myself up in the area of personal health and or the health officer conference room. I'm grateful to Shelley and John for helping Allegheny County's health planning team start in good fashion with the needs assessment. We're in a cycle a little behind Garrett right now, so we're doing a needs assessment, and I'm very excited to be modeling it after the one we saw presented today. And thanks for that. That's all for me right now.
Thank you, Dr. Porter. Anyone else? Seeing no other hands raised, we will adjourn the meeting. The next meeting will be March 27th. Thank you all for attending the conference.